Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in this latest video using the WAXscope. However, it's not myself performing this procedure, but an international ENT surgeon who's been using the WAXscope for the last, I would say, 6 months now. And we will reveal all very shortly, but this ENT surgeon will be providing training in the WAXscope in the near future. And they actually use the WAXscope for every single wax procedure they perform now, even ahead of their ENT operating microscope that they have in their clinic. So there's no better real testament to the WAXscope than the fact that this ENT surgeon is using it all the time and is absolutely really enjoy using it, uses it as a teaching aid as well. For his medical students, because obviously they can visualize the screen simultaneously to the surgeon performing the procedure. So this patient has a really stubborn and impacted wax impaction. It's quite dry, as you can see. There's a bit of a skin adhesion on the periphery, and you'll see the surgeon in a moment just come more laterally and remove some of that skin. And this plug is embedded within the latter third of the ear canal, a region of the ear canal we call the pars interna. And as we approach the eardrum, the ear canal does narrow and then it widens again. And at the point where it narrows, we call that the isthmus, and it's probably about 0.5 centimetre away from the eardrum. There's also a narrowing more laterally near the entrance in the pars externa region, so the outer third. And that's in between the region of the first and second bend. So as we enter the ear canal, about 0.5 centimetre in, we have a bend in the ear canal. So this is the patient's left ear. So the ear canal slightly bends to the right, and then another 0.5 centimetre beyond that point, the ear canal then bends in the opposite direction. So that's where you get the second bend. And in between the first and second bend, we have another isthmus, another narrowing. And quite often you get wax impaction in that first isthmus. So as the wax is trying to naturally migrate, it gets trapped in that narrow region. So the ear canal goes to the right and then to the left. You can see the surgeon actually manipulating the speculum to navigate the bends and to stretch and dilate open the ear canal. And so this wax plug is more or less loosened now. So all that skin adhesion around the periphery that's enveloped the wax plug and adhered to the ear canal has been removed. You can just tell by the colour of this wax, it's been there for a while. It's really dark, so it's oxidized. There's a few hairs matted in, so I don't know the gender of this patient, but I suspect it may be male, because quite often you have male patients with a lot of hairs in the ear, and that's just because as men age, all the hairs that are normally located on the outer third of the ear canal, they become sensitive to testosterone. In the earlier years, the hairs around the ears are somewhat desensitized to testosterone, and later in life they activate and they become sensitive to testosterone, so the hairs become a lot thicker. You get more hair follicles as a result as well. So it's just a bit of keratin at the top of the ear canal. You're going to see the surgeon use some micro forceps. And what I have noticed with a lot of ENT, they're very masterful with manual instruments. You've got a lovely view of the eardrum there. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.